First available report on crochetage of the QRS in ECG of secondum atrial septal defect dates back to 1959. Crochet is a French word which Google translates to hook and crochetage to lock picking. Heller and Associates in 1996 reported on crochetage notch on R-wave in inferior leads as a new independent electrocardiographic sign in atrial septal defect. They mentioned that crochetage is French equivalent of notch while citing the 1959 study of 11 patients. Heller and colleagues noted a sensitivity of 73% and specificity of 92% if the sign was present in all the three inferior leads. Early disappearance of the crochetage sign after surgical correction of atrial septal defect was found in 35% of cases, even when the incomplete right bundle branch block pattern was persisting. They found that the incidence of the crochetage sign increased with larger anatomic defects or greater left-to-right shunt. Their study cohort had 1,560 older children and adults, of which 532 had secondum atrial septal defect, 266 had ventricular septal defect, 146 pulmonary stenosis, 110 mitral stenosis, and 47 cor pulmonale. 459 were normal subjects. They noted this finding in only 7.4% of the normal subjects, 1/3 of those with other congenital heart disease, and 1/10 of those with acquired heart disease. A retrospective study of 314 patients who underwent percutaneous device closure of secondum atrial septal defect suggested that crochetage sign may be used to predict the risk of late atrial arrhythmia development. 57 patients in their cohort presented with late atrial arrhythmias. Of these, 30 had new onset atrial fibrillation nor flutter, 27 patients with pre-procedure paroxysmal atrial flutter or fibrillation had recurrence during follow-up. The authors noted that the presence of crochetage sign and older age at the time of closure of the atrial septal defect were independent predictors for late atrial arrhythmia. They thought that the crochetage sign represented heterogeneous ventricular depolarization due to long-term hemodynamic overload. The ECG illustrated here shows the notch at the apex of the R-wave in leads 2 and AVF and a notch in the ascending limb of R-wave in lead 3. This ECG also shows right atrial overload as evidenced by P-wave amplitude of 0.3 millivolts in lead 2. Incomplete RBBB pattern is seen as slurred S waves in lead 1 and RS-RS pattern in V1. Here are the relevant journal references. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.